Hello everybody and welcome to this video. This video I will show you two cases from the Virtual MSK Fellowship that I just replied to. So people are bringing their cases, ask their questions, and we discuss these cases in the Virtual MSK Fellowship. Let's start with case number one. 18-year-old guy, and he had no trauma, swelling of the muscle around the shoulder. And here is what we see. So the discussion then was along, why is there no trauma? Could this be Parsonage-Turner Syndrome, as in denervation, etc.? And while people then realized, okay, there is edema and there is an affected muscle also here, the latissimus dorsi, teres major, they are innervated by different nerves. I think that's why the Parsonage-Turner Syndrome or plexus neuritis was one of the differentials. But the other shoulder muscles here are fairly normal, or they are normal. And so I think what happened here in this case, something to realize. So Parsonage-Turner Syndrome doesn't really go along with a lot of edema around it, also here. And it also doesn't really go along with lymph nodes. And I think there is one area where we see some lymph node here. And also we see some other areas of muscles which show like baby strains. And we see the guy is very strong. So there's a lot of muscles that, tells me he's probably in the gym. And when you see something like this, an acute swollen muscle without trauma, then we need to keep in mind something that's called exercise-induced rhabdomyolysis. And I think that's a nice case. And there are some case reports. So let me just find this here that I can show you. And we can probably just go straight to images, or we add MRI, teres major. And you can see here examples of exactly that. So here's a nice example. This is pretty much the exact same thing. Other muscles can also be affected, but acute swollen muscle, perifocal edema, and I think that's a similar case here, this one here. So exercise-induced rhabdomyolysis of the teres major. The other case that I want to show you, which was also a nice case, 20-year-old guy, 1 week with a palpable mass in the arm, pain, no color changes, no temperature changes. And the discussion is around the differential. And the differentials have been posted that it could be, of course, like a tumor, like a peripheral nerve shift tumor, etc. But let's go into this case again. And we see, of course, the mass, easy to see. But what you need to identify here is the surrounding soft tissue edema. Totally abnormal here in the subcutaneous tissue. Tumors not normally present like this. This is the normal fat. This is abnormal. And we can check on axial, where is the tumor. We see the nerve here, median nerve. We see the ulnar nerve is coming here. It's just behind it. So it's close to the ulnar nerve, but it's not really in the nerve, or it's not in the wall. And even for nerve shift tumors, that edema is not normal. Now, it's fairly large, and I think they gave contrast, and you see it's vividly enhancing as well. Still, a lot of inflammation, not typical for a tumor. And this in the elbow at that location is a lymph node, most likely at least anyways. A epitrochlear lymph node, and this can happen with cat scratch disease. So let me show you here. I think I posted a link here together with my answer. Lymphadenopathy at the medial epitrochlear region in cat scratch disease. So I want to show you an MRI case. Let's go to, no, we don't need this, MRI. And then you can see these lymph nodes can become very big. So here's a nice example here, vivid enhancing lymph node, big mass exactly at that location, maybe even a bit higher up, kind of multiple lymph nodes. So yeah, don't forget lymph nodes at that location. They're bigger than you would expect the lymph nodes to be, but I think the fact that we have this surrounding edema here, the history of just 1 week, you don't really get a tumor in 1 week, and that's a location where you would feel a tumor that size much earlier than just in 1 week. So cat scratch disease, most likely, that's one of the explanations. But anyways, lymphadenopathy here in the epitrochlear region. So these are just two examples of cases where I provided some feedback today in the Virtual MSK Fellowship. And if you want to learn more about the MSK Fellowship, go to www.onlinemskfellowship.com. You can watch the free training there. You can book a call to discuss the course with us. And I hope to see you soon. Bye-bye.